In this video, Dr. Silverman will answer frequently asked questions regarding gender selection. What is gender selection?
So, gender selection is a technique that allows one to choose the sex of the next pregnancy. It can involve sperm separation prior to an insemination or sperm separation prior to fertilization and obtaining the pregnancy.
What is G-SMART method?
So, the G-SMART method is a combination of methods that build on the original sperm separation method to not increase the rate of success of choosing the sex of your next child, but to increase the pregnancy rate. And it hinges on two factors. One, the timing of the procedure, which is done by urine testing in a sophisticated method. And secondly, by using the TEASE method to increase ovarian blood flow and uterine blood flow prior to the insemination.
What is the Silverman method?
The Silverman method is a combination of two methods. The first one is the G-SMART to increase sperm of the desired sex. And the second part is using these selected sperm for in vitro fertilization. Using this method, you are able to pinpoint and select embryos of the chosen sex. I believe that I'm the only physician or only group in the world that uses this combined technology.
How is the Silverman method different from other methods that are available to women today?
The Silverman method is unique and different from all other methods available to patients. Number one, it combines the G-SMART method, which will selectively increase sperm of the chosen sex. And secondly, those sperm are then fertilized to the eggs. And through PGD technology, those embryos are then analyzed for both being normal as well as the chosen sex. I believe that I'm the only group in the world that offers this combined technology, and preliminary data seems to yield the fact that probably it works almost as successful as G-SMART alone.
What is the success rate using the Silverman method?
The success rate of the Silverman method will be 99% of the chosen sex, but it will not increase the pregnancy rate of conceiving.
Does your method increase the pregnancy rate?
The Silverman method does not increase the success rate of conceiving by IVF technology. That is rather fixed depending on the time of year and the group in question, but it has a maximum of about 65% pregnancy rate. What it does do is that if you do become pregnant, you have a 99% chance of having a child of the desired sex.
Is gender selection legal in the United States?
The Silverman method and the G-SMART method are both legal in the United States. And over the 25 years I've been offering this technique, I've helped thousands of patients.
Do you accept patients outside of the U.S.?
The reason that I'm accepted and see many patients is because I've been involved in gender selection for over 20 years. And I have a good track record, and my patients appreciate the personal care that they'll get as opposed to going to an institution.
Who's gender selection for?
Gender selection is for a number of reasons. One, couples that want to balance their family ratio of boys to girls. And secondly, for those couples that carry a chromosomal defect that will affect boys, it's sex-linked and not affect girls. And they'd like a normal child, so they'll choose for a daughter who herself will be normal, even though she may carry the defective gene. Secondly, for couples that have habitual abortion, I really don't feel it's appropriate they go through gender selection until the reason for their habitual abortion is solved.
Is there an age limit for gender selection?
There really is no age limit for gender selection, but one has to realize in a woman who's 40 and above, whether she tries to get pregnant on her own, or whether she does gender selection, or she does gender selection combined with IVF, the pregnancy rate is going to be low. And financially, it's an issue of spending a lot of money that the couple may not have the liberty to use to something that has a low success rate. If they're financially well off and they understand the risks of going through the procedure, because don't forget it, a woman above age 35, unless you do IVF and check the embryos, you're going to have a higher risk of a Downs baby. But given those factors, if you understand what you're entering into and can afford it, then I would accept them as a patient.
Are there any risks of gender selection procedures for baby and the mother?
The risks of gender selection method for the standard G-SMART method is negligible for the baby because there's no evidence to show that doing gender selection increases any risks whatsoever for the baby. The mother, on the other hand, really only has a risk if she does a form of IVF because there's always a risk of bleeding and or infection. Admittedly, it's very low, but it can occur.
What is the cost of gender selection?
The costs of gender selection vary based upon the patient's individual circumstances, but primarily on the method chosen, and it varies between $2,000 and $24,000 per cycle.
Are there any financing options available?
Generally speaking, gender selection is not covered by insurance because it's a completely elective procedure, but if you need help financing it, we do have financing options available.
Typically, how long does the process take?
The time involved with gender selection depends on the method chosen. With G-SMART, it only takes about 24 hours. For the Silverman method, which involves IVF plus the G-SMART method, it takes about 2.5 weeks. But if you're outside the U.S., the procedure can be started in your home country, decreasing the amount of time that you have to be in New York.
How many times can the procedure be done?
Gender selection can be performed as many times as a couple wishes. Since there are minimal risks involved, there's no reason not to do it. The limiting factor will be the couple's finances.
Why Dr. Silverman?
The reason that patients come to me is because I've been offering gender selection for over 25 years. And in fact, about 10 years ago, my data was combined with several other groups that performed a similar method, and the success rate is truly about a 40% increase over the natural rates. Secondly, you'll get personalized care by a caring physician, and you won't be waiting for hours to have your blood test or your sonogram performed at an institution. And since my success rates for both the G-SMART as well as the Silverman method are as high as anyone else's in the world, why not come to me?
Thank you, Dr. Silverman, for answering all of our questions. What would you like to say to your potential patients considering gender selection?
I have been performing gender selection for over 25 years. My staff and myself are both warm and caring, and will do our utmost to help you have your dream of a child of the chosen gender.